Hey guys, welcome to Quick Nursing Shots with Smita, and today we are going to discuss a very small topic from digestive system. The topic is gastritis, and this picture which I have put intentionally over here, it says the Helicobacter pylori, which is a bacteria doing something in our stomach, and we can see that our stomach lining something is happening, right? So yeah, that is gastritis. So moving on with the definition. Gastritis, it's a common GI problem. Gastritis may be acute, lasting several hours to a few days, chronic resulting from repeated exposure to irritating agents or recurring episodes of acute gastritis. Okay, so what is gastritis? So for our very beginners, which just have joined nursing, or maybe you are in our second year, so yeah, any word which has this itis word attached, it means inflammation. Okay, so wherever you see with whichever organ this itis word is attached, it means the inflammation in such area or in that particular organ. Okay, so it's inflammation of gastric mucosa. Now I would say, what is gastric mucosa? So here you see a normal picture. So what is this normal picture? It's a normal picture of our stomach. Okay, so these, you see that pinkish outlining. Okay, so this is nothing but it is our mucosa, and these lining is that the gastric mucosa which is being affected in gastritis. So when any bacteria which we saw, that is a Helicobacter pylori bacteria, when that interferes with this lining, ultimately this thing happen. Okay, so inflammation, erosion, perforation occurs, and this is called gastritis. Then classification. So basically we put it into two types of classification, and I would say if you see any medical condition, if it doesn't have a classification, that's well and good. If it does have a classification, then majorly it will be in acute or chronic state. Okay, so acute is generally happening in in an onset or very short period, which will be resolved in short period. Chronic is something which is gonna take year and year. So yeah, when a person is keep on having gastritis, then the person is actually having chronic gastritis, which is to be treated medically and maybe surgically. So yeah, moving on to the pathophysiology. So the pathophysiology says that the mucosal lining of the stomach normally protects it from the action of gastric acid, which is HCl. Now the mucosal barrier is composed of prostaglandins. So our this mucosal barrier is actually composed of some prostaglandins. Now I put this flow chart. So yes, if you are in your first year, then you must not be seeing this. Obviously it comes in second year mid search. So yeah, so any pathophysiology, you don't have to write a para and para. So it comes in a flow chart, which I put it here with arrows. So it says that due to any cause, so cause is nothing but the etiologies, the reasons. So when a person take NSAIDs, like must be misusing NSAIDs, or they must be taking aspirin for a long period of time, or maybe high intake of alcohol, bile reflux. Reflux is, yeah, a regurgitation. Then infection like Helicobacter pylori, which we indicate with H. pylori. Okay, so when due to these causes, this barrier, which is our mucosa lining, this barrier is penetrated. So once this is penetrated, then HCl acid comes into the contact of mucosa. Now this HCl is directly interfering with the mucosa lining, and mucosa, our skin, when it cuts or we get some burn, we know how it feels like. We feel that irritation happening over there. We feel a kind of discomfort or pain. So the same thing happens inside our body. So this mucosal lining, which it gets penetrated or get affected or get peeled off because of these causes, so this HCl acid, it comes directly in the contact with the mucosa, and then the injury into the small vessels happen. So when there is any injury inside our body or outside the body, we have experienced edema, which is inflammation, then hemorrhage. Why we use hemorrhage over here instead of bleeding? Because hemorrhage, it indicates internal bleeding, so yeah, it's happening inside our body, so we say hemorrhage. And possible ulcer formation happens. So when this ulcer formation happens, that's a big deal. Okay, so it could be benign, which is okay, but when it turns into malignant, that's gonna be something very cancerous, right? It's a tumor. So yeah, this happens. So this could happen in pathophysiology. It says that how this bacteria or some other factor interfere with the barrier mucosa lining, and then HCl directly comes in contact with the mucosa, and then basically this HCl acid is the thing which is injuring our mucosa, and then edema and hemorrhage and possible ulcer formation happens. Okay, I hope this part is clear. If not, then you can just say in the comments. I will be taking a different class for you, and then we will be moving on to the another slide which says clinical manifestation. Clinical manifestation, in the other word we call it signs and symptoms, but medically we use this word. Okay, so now I have put this clinical manifestation, actually symptoms, in two sides. So yeah, as I've said, gastritis could be acute or chronic. So first we will see acute. So in so in acute, first is abdominal discomfort. Yeah, so it's happening in our stomach. So we all have experienced this discomfort. Now with the word discomfort, we know how what it is and how it feels. So some anything happening inside your stomach, you know how discomfort you feel. So you will write the first symptoms. Blindly you write abdominal discomfort, and then headache. So why we are having headache over here? So when the discomfort is in our stomach, but we are having headache because you see the fourth here, anorexia, which is something eating disorder. So when you do not eat properly and you don't feel like eating, so when you don't eat, ultimately you get headache, right? The lassitude and nausea, vomiting. Nausea, vomiting comes under any neuro and gastric disorder. You can write nausea, vomiting. Then hiccups. Hiccups also come because of this acidity, which we actually call acidity. And then some patient, however, they will not be showing any symptoms in acute gastritis. They will just show a kind of discomfort, and they will be taking pantoprazole by themselves, and then it will be subsided. Now the chronic gastritis, you won't be seeing much difference in the manifestation, but as I said, it's a long period problem. So yeah, the person will be having all these symptoms included. They'll be having anorexia over here. When you're having discomfort, like terrible discomfort in your stomach, you won't be feeling like to eat, right? So anorexia. Then heartburn after eating. Why we are having heartburn? So heartburn is basically related to the HCl. So that HCl and bile, it gives that heartburn sensation, and a sour taste in the mouth. And the sour taste is again because of the bile reflux, because the bile is keep on coming over by our stomach sphincter. So that give a metallic kind of, actually not metallic, but it gives a sour taste in our mouth. Then nausea, vomiting, belching is the same thing. We feel like something is coming back, like the food whatever we have eaten, it's coming back. And then malabsorption of vitamin B12. So this is the major symptom. Okay, person will look kind of malnourished because of this, because there is a malabsorption of vitamin B12. When there is malnourishment of B12, it means that the body is not taking whatever you are eating. Maybe it is rich in vitamin B12, but the body will not absorb, and you won't see their action. So ultimately you will have deficiency of vitamin B12, and then the symptoms related to that. Okay, so moving on to the next thing, that is assessment and diagnosis. So any disease we need to first assess. We can't just go on the treatment part by saying that the person have these all the symptoms. No, we need to get confirmation. We need to be confirmed before giving any medical treatment. So it says that absence or low level of HCl acids, or maybe there's a high level of HCl acid. So how we get this? we there is a test. In that test we get to see the level of HCl-ACA. When it is below or above the normal range, we may say it's a gastritis. Then usually we suggest the patient to go for endoscopy. So endoscopy, it's a telescopic tube which has a camera over there. So the doctor or the physician, they will just direct it into our mouth, and then they will be visualizing it on the system or computer screen, how it goes inside, and they'll be seeing your mouth, your esophagus, and then gradually it will go more advanced in, and then we'll be seeing the stomach, how the stomach lining is, and it gives a very clear picture. Okay, very clear picture we get through endoscopy. So endoscopy is kind of mandatory. Now the upper GI radiographic studies, so we will be going for upper GI radiographic studies, which may have x-rays and then biopsy. So biopsy is something which we do not do in generally in all the patients, but yeah, biopsy becomes mandatory when the person is having a chronic gastritis and person faces this gastritis problem for a long period, because then there is a chance that it could be cancerous. So any cancer thing we need to identify by the biopsy. So we'll be taking a small tissue specimen or and we'll be giving it to the laboratory, and then they will tell you whether it's a cancer thing or not. Then serologic testing for antibodies. Yeah, we need to see H. pylori antigen. Antibody is available in, it will be available in our body if we are having this infection. So we'll be looking for the antibodies of H. pylori. Okay. So moving on to the medical management. So medical management says as the causes. So again, it's a pro tip I'm going to give you. If you remember the etiology of the problem or the disease condition you are learning, when you know the etiology, ultimately you know the medical management. Okay, so whatever is the reason, you need to cut off those reasons and the problem is resolved, right? So yeah, that was the plus point I'm giving you here, so you need to remember that. Now, as we say, the cause could be alcohol, yeah, or cause could be contaminated food. So we need those food and the alcohol to be cut off from the person's life. And the second thing is non-irritating diet is recommended. Why we say non-irritating diet? So yeah, there are so many diets, right? We have spicy, some people have very bland diets. So yeah, in these cases, if you're having any stomach issue or something in your home, generally your mother will be giving you a bland diet, right? So that bland diet will not be interfering with anything, so it will easily go, it will be easily swallowed, easily, not easily digested when you're experiencing some digestive problem, but yeah, that will not be causing any irritation inside your stomach. So we give a non-irritating diet, and then IV fluids. So why we are giving IV fluids over here? It's not diarrhea, but still we are giving IV fluid. Yeah, of course we need to, because the person will not be tolerated to take oral fluids, right? They won't feel like to take anything by mouth, because ultimately it has to go in the stomach, and the problem is actually in the stomach. So person will itself say ki, no, I don't want to have water, I don't want to have food. So we will start with IV fluids, and then diluting and neutralizing the offending agents. So offending agents, what is this offending agent? So offending agent is the main thing, that is HCl acid. So HCl is something producing alkali all over our stomach. So we need to take some lemon juices or vinegar. So we are using these things to neutralize those agents inside our stomach. Then emetics and lavage. Lavage is actually that lavage is stomach wash. So emetics are those which we take in case of nausea and vomiting. So we say that we should not give emetics and lavage like bowel wash. Sorry, not bowel wash. Yeah, it's stomach wash. So yeah, these two things are avoided. Why we avoid these two things? Because there is a possible danger for the perforation, or we may damage the esophagus, or we may further damage the stomach lining or stomach by doing these two things, because we don't want the person to uh, get we don't want that person to have a more severe condition, worse condition. So we avoid these two things. Then NG intubation. NG intubation, why we need to do NG intubation? Because the person is not going to take anything by themselves. They will be NPO, or generally patient will be NPO in this case. And then we need to put a nasogastric tube via their nose, and it goes into their stomach, and then we'll be feeding them. Okay, so those feeds are very watery kind of feeds, and it's a nutritious feed also, because the person is not going to take heavy diets. So yeah, we do that. Then analgesic agents, we give them painkillers because of the discomfort. And in very minor cases, like, not in minor cases, like, to few patients will be giving sedative. Sedative is not generally which we give to every patient. Okay, if you forget to write sedative in your examination, that's not a big deal. Okay, sedative we don't give to every patient, but yeah, if patient is having cancer, then we need to give them sedative. And then antacids are again the same thing, uh, for minimizing the production of HCl. So we give them antacids as well. Now, the person is having chronic gastritis, which will be probably managed by modifying the patient's diet. Yeah, we need to modify their diet completely, and we have to ask them to take rest as much as possible by them. So they have to take rest, they have to give them a proper rest to their full body. Reducing stress, so there should not be any stress, because again, our body will itself start producing so many things inside our body. So yeah, reducing stress in such cases. Then initiating pharmacotherapy. Pharmacotherapy is the medicine which we provide, and the doctor prescribes. So yeah, Helicobacter pylori may be treated with antibiotics. Any bacterial infection is treated by the antibiotics. So in this case, we generally we give them tetracycline or amoxicillin. Okay, so amoxicillin will be giving, or we give them a combined of antibiotics. Maybe two antibiotics together will be giving to treat the infection. And a proton pump inhibitor like lansoprazole, and possibly we give them bismuth salts. Okay, so in extreme cases, when the patient is having a severe problem, okay, very worse condition, then emergency surgery may be required to remove those gangrenous or perforated tissue which is there in your stomach, which is very badly injured and cannot be treated by medicine. So maybe to save our patient's life, we need to go for an emergency elective surgery. Then comes nursing management. So before nursing management, we'd see the nursing diagnosis. Why I put this slide before nursing management is because, so we'll get to know what are the diagnoses we make, and based on that only our management would be. So first of all, you will assess the patient. Okay, what are the patient symptoms are, what are the patient facing. So patient will be having anxiety related to the treatment, because the treatment is angi-tube, like putting angi-tube in patients. So it's a very discomfort thing, and the person will, maybe the person will say no, I do not want, because it's actually very discomforting. If anyone have you seen any patient with that, so you know how person feels. They will feeling very difficulty to speak, they will not be able to sit properly, they'll feel like something is hanging in their nose. Okay, so that discomfort which ultimately gives them anxiety. Then imbalanced nutrition, something is happening in stomach, the person feels like not to eat anything. So ultimately, what is needed for the body, the person is not giving it. So imbalanced nutrition, less than body requirement related to inadequate intake of nutrients. Then risk for imbalanced fluid volume related to insufficient fluid intake and excessive fluid loss subsequent to vomiting. Risk for imbalanced fluid volume, here we didn't write that imbalanced fluid volume. We, yeah, you can write imbalanced fluid volume. If your patient is facing vomiting and such problem, then yeah, you can write it directly. But why I put it risk for imbalanced fluid volume, because the person may not be in that severe, in the person may not look very um, dull, but yeah, he's gonna become very sick if he's keep on vomiting. So yeah, that is a risk, and this is how we write. It's a Nanda diagnosis. I forgot to mention that. Now, the fourth diagnosis is deficient knowledge about the dietary management and disease process. Deficient knowledge, usually we you don't have to write this. Okay, this nursing diagnosis is not gonna give you too much of points, but yeah, if you lack diagnosis, like if you remember two, three diagnoses, and then you wanna write at least five diagnoses in your exam, then you can put this one and get a plus point. And then the last one is acute pain. So why put this acute pain at last? Because it's in a order. Okay, it's in a order I have put. So pain is something which we consider very to be very less, because it's a perceptional thing, right? So it depends on perception from people to people, from person to person, how they feel. So acute pain related to the irritated stomach mucosa. Now, based on these diagnoses, we're gonna make the management. First of all, there was anxiety, so we will try to reduce their anxiety, give them psychological support, and give them proper management. Like, before starting with any kind of treatment, go to your patient and explain them in detail what they are going to have in future, like what are the treatment they're going to take, and then the person will feel kind of confident for the treatment. So this will reduce their anxiety. And then second says promoting optimal nutrition. So how will you promote optimal nutrition? You can't just go to the patient and say you should eat more, because they are not in that condition, right? They can't swallow and they can't eat by their mouth. They feel like not to eat, and they say that I'm keep on having nausea, vomiting, then how I will manage to eat? So you don't have to pressurize the person. You can say once or twice, and once you see that the patient is actually having vomiting problem, do not do that. Okay, we can start with NG tube. That's because we have that. Once the patient is inside hospital, once the patient is your inpatient, then you can start with NG tube with the doctor's order. Third is promoting fluid balance. So a person is facing vomiting and fluid loss, then you have to promote fluid like via IV fluid. So you can attach a cannula to patient's arm or metacarpal area, and then we can start IV fluids again based on doctor's order. Then relieving their pain. So you can give them some analgesics. Whatever is prescribed by the doctor, you can give them if it is not contraindicated to the patient, and if the patient is not allergic to that medicine, then you can start giving that analgesic for relieving pain. And there are some other way of reducing pain, which I'll be taking a different class for that. Okay, so the fifth one is promoting home and community based care, which is our health education. So you need to, as a nurse, it's your major role in in teaching patient. You have to teach the patient about not only the patient, but you need to include their family member as well, because the patient, he could be a small child, or he could be um, a older age person. So there must be somebody to look after them, right? So you can always ask the family member to attend the health education, and tell them in a very clear statement, and the statement should be given in a non-medical language. Okay, you do not have to use any bizarre languages, because they may not be understanding. Okay, just give them health education in their own language, which is understandable by the patient. Tell them about the disease condition, tell them how it happens, why it happens, and how it will be treated, and how it is being treated, and how they can just avoid to have these problems. And you can provide them some supports, like we if we have any supports in our health, or in our healthcare, or in maybe in our community setup, we do have this support groups. So if that is being applicable to that patient, you can suggest them for that too. Okay, you can give some recommendations, and always give health education in a manner that is very much understandable, okay, for the patient, and they should understand it. So how do you know that the person have actually understood your health education? You can just ask them, to talk back. It's a talk back. It's a technique which we use in nursing. So we start asking the patient the same thing. Okay, so can you just recall about all the things I told you and how it happens? So once you ask the patient, let them ask you question if they have any query, and then later you can ask some question just to see if they have understood it very well. Okay, so this is the health education you provide them. So this is what we have seen overall. We have seen the nursing diagnosis, medical management, assessment and diagnosis, clinical manifestation, pathophysiology, classification, definition. Okay, so we have seen all these things and nursing management. So here it ends. And thank you for watching. If you have any query or any doubts, you can comment down and I'll let you know about what I can do. Okay, for now, goodbye and enjoy your day. Study well.